Hey everybody, Dr. Michael Miyasaki again here with Garrett Caldwell, CEO of the PAC and Corr Dental Lab. And this video or this recording is going to be about case selection. So the Pacific Aesthetic Continuum, we refer to it as a PAC, that is kind of powered by the laboratory work of Corr Dental Laboratory, puts on live patient courses. And one of the questions that we often get is, what kind of patients do you treat? How do I find a patient? How do I present this to a patient? And so this recording is going to answer all those questions. Why should you be interested in taking a live patient treatment course? And if you're going to take one, why the Pacific Aesthetic Continuums course? And what will you learn when you take this course? And then how to pick a case. We'll talk about case selection. Then from that, we'll talk about once you have the case selected, kind of logistics. So once you select a case, then the way that we work at the PAC is you would have somebody look at that case, an instructor or the course director who would then approve the case. And then once it's approved, what we're also going to talk about today is how to get your records together to send that case to the laboratory to get everything set up. So when you do the live patient treatment preparation session together as a group, that everything's ready to go. So this is really kind of the nuts and bolts of just the preparation. I know when people take these courses, and Garrett's seen this happen over the last 30 years, there's always a little trepidation. Should I sign up? Should I not sign up? What's it going to be like? How do I prepare? So this time that we have during this recording is really to answer those questions and make it so the whole experience becomes enjoyable. We're going to stress on how when you take a course from the Pacific Aesthetic Continuum, you really are learning the systems of how to approach a case like this. And that's what makes it, I think, a lot less stressful. We'll talk about the vision. One of the things that you get working with your instructors and the mentors and the course directors of these courses is you get a kind of listen to their vision that they have for their practices. And many times that their vision is much different than the average dentist vision. And so they are able to achieve, I think, above average results. And then the encouragement. Whenever you learn something new, you could study this course on YouTube and not have any encouragement, and you really don't go anywhere. And what the Pacific Aesthetic Continuum experience is really all about is everybody is there to encourage you, to help you actually achieve success. And so that's what this program is going to be about. Garrett, I
Oh,
know I did a
exciting.
lot. So what thoughts
It's
do you have?
great for our viewers. And the thanks. We're looking forward to for presenting this because like you said, Mike, a lot of our doctors have questions and they want to know about this case selection, what our group's about. What's exciting about tonight is uh, viewing this is we're doing it with our actual students that will be coming into the next three courses. So if you're viewing the video, understand that this is actually being presented for doctors that have already signed up for the program this year in 2025.
Yeah, you're absolutely right. This isn't going to just be a recording. This is going to
Right.
be a little bit of, we can have some live interaction because we've got, well, we finished one course this year and it was held in Sacramento area. Then we do have a group that we'll be doing in, well, late summer, I guess. That's the Bay Area. And then we have another group that we're going to be going through in Sacramento later this year, and then another group that will be working in Chicago. So 2025 turned out to be a pretty busy year, which is a good thing.
Yeah, and we could have, I'm not sure how many are attending tonight, but we have a large group of doctors that are very interested in answering that question. How do I select a case for a program and what's the program all about? And so this is going to be a great introduction video for anybody considering a program.
Yeah, we hope. Hopefully it's
We
good.
hope.
All right. So now we'll get into it.
Okay.
So I'm going to get started just to kind of give you a little bit of the background about this evening. Is this presentation's about preparing for the live patient aesthetic mini residency. So many of you already know what these courses are about. They're live patient treatment courses. They're the Pacific Aesthetic Continuum is providing the instruction, and then Corr Dental Lab is providing the dental work. And so we have the lab technicians with Corr. We have Gary Vaughn and Ryan Corr on this evening. We have Jimmy organized our Bay Area group. So thank you very much to Jimmy for doing that. And what I'm going to go through is talk about case selection, what we look for, what kind of cases are ideal for these live patient courses. Then we are going to talk about how to present the cases to your patients so that they cannot not do the course with you. And then we'll be talking about lab communication, because the lab communication part is how to get ready for the actual preparation session. So by the end of this presentation, hopefully we'll get it all done in an hour. Hopefully all your anxieties and trepidation are all kind of set aside, and you'll feel very comfortable about saying, yes, I'm ready to take the course. I'll be able to find a patient. And this is life-changing dentistry. So I'm really excited about presenting this to you. So I'm watching as I'm letting more doctors in. We're almost up to 30 tonight. So that's a great number to have. So let me jump ahead and we'll get started now. Okay, there we go. And I'm trying to get rid of that. I'm trying to erase that. It won't erase. So sorry about that squiggly line up there. All right. Oh, let me just check. I'm just checking chats coming through. Okay, cool. All right. So one of the things that dentists sometimes will say is, I don't have patients that need any aesthetic work. And I will tell you, one of the things that you'll learn from this course is once your eyes change, you'll see a ton of patients that need aesthetics. And aesthetics, I'll talk about it, can mean a lot of different things today. But if your eyes can see this and you can actually do the work, it will unlock this gold mine within your offices, within your practice. And if you're an associate, it's going to make you so much more valuable. If you are a practice owner, you're just going to have greater revenue. So we hope that that's what you experience from the course. And I don't know, Garrett, I know I didn't introduce you. We have Garrett, the CEO of Corr Dental Lab and the PAC. So just want to say hi, Garrett. So everyone knows who you are. You're the important person here. All right. So one of the things about this course is to prepare you to do aesthetic work. Because again, a lot of doctors will tell me, I don't have patients that need this type of work. And it's not that their patients don't need this type of work. It's just that the doctors can't see the opportunity to recommend this type of work. Their hands aren't trained to do this type of work. And that's what this course is really all about. So I want you to remember a couple things. What the PAC is really about is to give you systems. And I'll explain those systems to you during this next hour. It is to provide you with the vision. As I was saying, you're going to be around other clinicians that are doing this type of work all the time. And so even when same thing, I fall into the rut of doing my regular dentistry, and then I hang out with the instructors at the PAC and I hear the type of dentistry they're doing, and it motivates me to do more of this type of dentistry. And then the other thing is you can read the books, you can watch webinars and YouTubes, and you can get some of the information. But the thing that you don't get is you don't get the encouragement. So what the PAC is all about is to encourage you. It's not like going back to dental school, nothing like that at all. What we're going to do is we're going to work together as colleagues. We're going to share ideas. We're going to share how to achieve success. And from that, our heart gains a lot of joy from that, experiencing that opportunity. I'm going to see if I can mute people. Sounds like there's dishes being done. There we go. All right. So once you can do this type of work, you change lives. Because if you've ever done an aesthetic case, like a veneer case, patients will come back, and every time they come back and they tell you how much they love their smile, and they give you hugs and kisses almost every time they come back. Every 6 months, you get more positive reinforcement. It's really fun. When you do a root canal on the crown, you're lucky if they ever mention that to you again. So doing aesthetic work is really kind of refreshing. So the more you learn, the more you'll see, and then the more you'll do. We can guarantee it. So it's systems, vision, and encouragement. And that's the key part of what the PAC's all about. So you look at these veneer preps, right? So well, on the front two teeth, 8 and 9, we have crown preps, and we've had some soft tissue recontouring. If you look at the other parts of this, sorry, you got the conservative veneer preps with slice preps on these laterals. So you can see it's a very conservative veneer prep, but we have slice preps. And then as we go through here, we have a cuspid with a bevel on the inside ledge. Here we have a cuspid, we have a cuspid with a chevron on the other side. Let me go to a pointer. And let me go back. So here we have a cuspid with the chevron. Here we have a cuspid with the bevel. Here we have 2 crown preps because we took off 2 crowns. Here you have the soft tissue recontour with the soft tissue dot laser. Here you have the cuspids with the chevron over the buccal cusp, all things that we talk about. Here you have the cuspid with the elbow. So hopefully those are things that you already know, but if you don't know those things, those are all things that we'll cover as we do the course. Let me see. I got to admit more. We have surpassed the 30 mark, I think now. Getting really close. All right. Yeah, we're at 30. So these are all the things that we teach during the course, all the little nuances of the preps. And the other big thing is we do 10 units. So a lot of us don't do 10 units of dentistry on a regular basis, but in this case, we're able to just do 10 units, and it kind of expands what you see as what's possible in your practice. So why do you want to do this type of dentistry? Because it's really fun. We get back maybe to a first molar when we're doing an aesthetic case, but we're usually not trying to work on a second or a third molar. Everything today is aesthetics. If I place an implant, it has to be aesthetic. If I'm making a denture, it has to be aesthetic. If I do a composite, it has to be aesthetic. So we talk about color, we talk about contour, and this type of dentistry, as I mentioned, is what really changes patients' lives. It also allows you to make a better living because instead of doing one tooth dentistry, you're doing tooth dentistry, which ultimately makes you happier. And I don't know, we have a great time. We've got friends that are lifelong friends that we've made through our experiences with the Pacific Aesthetic Continuum. So this course, I really believe, will change your career for the better, change your life. You can reach out to any of these people and ask questions, material questions. My periodontist reached out to me today, asked me about a composite glaze. It really, you become this collegial body of clinicians. So that's why I'm encouraging you all to take these courses. But the next question is, well, what kind of cases do I treat? And it sort of depends on where you are. So I want to talk about case selection. Oops, sorry. The case selection, we've got three different levels. Level one is just your straightforward aesthetic improvement. So typically what we're going to do is we're going to do 10 aesthetic restorations, so 10 veneers. Level two is we're looking at the aesthetics, but we're also looking at possibly make a functional improvement. So level two doesn't necessarily have to involve functional improvement, but oftentimes it does. You have that patient that has that worn dentition and you want to place veneers on their upper arch, but they've lost vertical. So what you're going to do is you're going to restore their vertical, the anterior posterior position of the mandible against the maxillary restorations to improve the aesthetics, level out the occlusal plane. And ultimately, it may require that you do two arches. But in level two, what we do is we do two arches in two different visits. So the first appointments, we would do the upper arch, and the second appointments, we do the lower arch. Level three is where we do aesthetics and functional improvement, but we just treat two arches in one visit. So we set the case up, we prep out all 28 units, and then we bond all 28 units in a different session. So it's really a lot about efficiency, setting up the cases so you understand the occlusal outcome that you're looking for, and then working with the lab to achieve that. So I'm going to really focus on level one mostly today. That's just a straightforward 10 unit aesthetic restorations. So level one, again, it's just straightforward aesthetics. Somebody comes in, you can have a crown in those 10 units. You can even have two crowns, but try not to do 10 units of crowns because most of you learned how to do crown preps in dental school, but you didn't learn how to do veneer preps in dental school. So the more veneer preps we have a chance to show you how to do all those different types of preps, I think the more you'll get out of it. So the more of those 10 units that are veneers, the better. Preferably you're going to do 10 units of veneers, but if you have a crown here or there, that's fine. So this is Angelo's case. I just threw this in here, Angelo, because I think you did a wonderful job. But he was in our Sacramento course, and if you look, the top two pictures are his pre-op photos, and the bottom pictures are his post-op photos. Really nice job. Uh, Angela's going to be on that instructor track for us because he does a great job, handles the patients really well, and knows everything. So level one, we go through photography, smile design, talk about case presentation, lab communication, materials, treatment planning. Are we going to do no prep, minimal prep, or just a full prep type of case? With conservative aesthetic preparations, we talk about the elbows, slice preps, bevels, the chevron shoulders, the bicuspidization of molars. We could talk about midline shifts. We talk about soft tissue recontouring, multi-unit temporization, and multi-unit cementation. So level one has a lot in it. This was Dr. Yazzi's case. The patient on the left-hand side, he had two crowns on 8 and 9. So she redid those two crowns, the veneers across the upper, and then during another session did the 10 units on the lower anterior. So down here you see he has this nice smile that he's always wanted. All right, level 2 and 3, two arches, typically treated for aesthetic and or functional reasons. Level 2 again is a full arch prepped and seated, and then typically what we'll do is we'll place a lower orthotic. And a lower orthotic may not mean a lot to you right now, but don't worry, we go through that during level 1, so you know how to prepare for level 2 and 3. Level 3 is doing both arches, top and bottom, where we prep both arches in one session, and then we seat both arches during a cementation session. We use an orthotic with these two levels, 2 and 3, to determine the bite position and confirm that we have a good stable position to restore our patients to. One of the biggest parts of levels 2 and 3 is how we communicate to the lab, to how to set our cases up, because this is a big part. Prepping out 28 units and cementing 28 units is one thing, but being able to work with the lab so that everything goes smoothly, that's kind of the important part of what we can learn in the course. I'm just looking down. I'm gonna take one little. I'm just checking the chats to make sure I'm not missing anything. Okay, good. All right. So level 2 is just a two-step full mouth rehab. So what we talk about is a TMD examination. We have to be really thorough to make sure we have the patient set up right. We then take a bite registration, get the patient orthotic to confirm we have the bite right where we need it to be. We then select the smile design. We do a full mouth diagnostic wax up. So lab usually waxes up the upper and lower arches. During the course, we talk about how to prepare the upper arch, how to temporize the upper arch, but one of the big things is how do we record the bites? We don't want to lose that maxillomandibular relationship. And then we will typically prep out the full upper arch, 14 teeth, typically in one session, fabricate an orthotic on the lower arch, and then the patient will come back, we'll bond in those top 14 units, and then sometimes make a new lower orthotic. So this was one of the patients during our last course. You can see Vince has a kind of reverse smile line. So the doc had to level out the upper arch, and the lower orthotic is in the mouth right now. So if you look at on the left-hand photo how the lower teeth had that wear, we don't see that here on the right-hand side because there was a lower orthotic. And these were the photos taken during the cementation session. So the patient's still kind of getting used to everything, but just want to show you how that works. So in level 2, we cover everything that we covered in level 1. Kind of reinforce it, but now we stress more occlusion, bite registration, and the use of orthotics. We talk about the bite transfer, the bite registration, and then how to prep everything out.
Doctor, I have a question.
Yes.
So I have a patient says upper and lower, we're gonna have to do it for these sessions.
Okay.
So does that mean that I will do the first 10 unit first and then use the level 2 for the second? Or do you want me to complete both upper and lower in one sessions?
No, you don't. You don't have to do upper and lower in one session. So yeah, we'd probably do we'll look at the case, but we probably would do the 10 uppers first and then do the lower
Okay.
second. Yeah.
Okay, no problem. Thank you.
No, thank you. So then level 3 again is just to show you what we were stressing, the TMD exam. And then now it's down here on the bottom, prepping out 28 teeth in one session and bonding in 28 teeth in one session. So it just depends, level 1, 2, and 3, to what extent you want to carry your learning experiences. We have a lot of doctors that will do level 1s 5 times. All they want to really do is just do aesthetic cases. They don't want to worry about the occlusion. And so, but they want a lot of experience. And so what they'll do is they'll come back and do level 1 and level 1 and level 1, and that's fine. Then we have other doctors that want to learn how to do level 2 and level 3. So it really, you can take this to whatever level you want to involve yourself with. So this was a case that was done in the PACS level 3 course where the doctor came in. He had this patient with this very worn dentition, had lost vertical, and then the doctor figured out the occlusion. And on the right-hand side, the day that the case was seated, that's what you see over there. And so made a huge change in this patient's smile, patient's life. So that's the type of dentistry, if you want to go to level 2 and 3, that you can take this education. So that's just kind of so what we covered is why I think it's really important to take this type of training. And then I just want to show you how the different levels work, 1, 2, and 3. Don't let it scare you. You don't have to do 2 and 3 if you don't want to, or some of you will find it very exciting. And some of you will get in there and say, okay, I don't want to do 2 or 3 yet. But when you get really comfortable with level 1, you'll say, okay, now I'm ready to go level 2. And then when you get comfortable at level 2, you'll say, okay, now I want to go level 3. And that's where it gets really exciting because I think it really is a thing of comfort. We've all been there. When I took my first live patient treatment course, I remember I had never worked on 10 teeth all at one time. Like if I did a 3-unit bridge, or maybe I'd done a 5-unit bridge in my career, that to me at the time was a lot of dentistry. And I remember I signed up to take a live patient treatment course and I was getting ready to go. And I thought, wow, I'm going to have to work on 10 teeth and I get, 3 hours of time to do that. I've never done anything like that before. And once we got to the point where I took the course, nothing in dentistry was ever the same after that. Everything else seems so easy. It's like, okay, I'm just doing 10 now. And doing 28, okay, I'm going to do 28 units. But when you reach this level of comfort where you understand how to change things, what you need to change, and how to plan for that change, it does take all that anxiety out. So tonight we're going through the orientation. After tonight's presentation, hopefully you have a better idea of your case selection, then how to present that case to your patient. So your patient says, I'm ready to go. Then if you were doing level 2 or 3, we would have you figure out their occlusal framework scheme. So if you're doing level 2 and 3, we'd have you get the patient on orthotic and then do case approval. So at that point, you go to your instructor, mentor, or the course director and have the case approved. And then what we do is we send that case to the lab to have everything, all the workup done. Then the first session, so the sessions will run in 2 days. The prep weekend, we have day 1, which is a lecture about what we're going to do when we get into the clinic. And then day 2 of that session, we do the live patient treatment. What I recommend the doctors do is after we get the temporaries in the patient's mouth, is get the patient back a week later just to be sure that they like the way everything looks, they like the way everything feels, and kind of get the patient's approval to move on. Session 2, what we do is it's 2 days again. The first day of that second session, we go through multi-unit cementation as far as lecture. Then day 2, we do the live patient treatment where we're going to bond all the units in. And then at some point after that, we usually do a case review where we talk about what we learned from the cases that we did. And then the doctors will then progress up to the next level. So it is really fun. It's just friends helping friends. It's nothing like as I mentioned before, our experiences in dental school. So today I'm kind of focusing on the top part, just how to get through those first lines, everything up to that preparation lecture. So here we're talking about level 1, 2, and 3. So the differences in level 1, usually we take 3 hours. Level 2 is 4 hours. And level 5, where we're doing both upper and lower arches, we take 5 hours. What I would do in all 3 levels is encourage you to find a patient that is super cooperative, right? You don't want to have somebody that is difficult to work with, constantly talking, I put down, you don't want TWB, which is teeny weeny bladder disease, where every 5 minutes they're like, oh, can I go use the restroom? That type of thing. So you don't want to have a patient that makes it difficult for you to focus on what you need to do. You want somebody that's periodontally healthy. Why is that? Because if their gums are swollen or if they're bleeding, you're not going to be able to place your margins exactly where your margins need to be. And if when they come back for cementation, if there's a lot of blood or saliva all over, you're going to have a really hard time doing your cementation, isolating that area so you don't have blood going up underneath your margins. So you need to have a cooperative patient, somebody who basically just sits in the chair, says, "Hey, doc, I trust you," and all the other docs that are going to be coming in, they don't mind us talking over their mouth, so to speak, as we're doing the work, and that they're periodontally and TMJ occlusally stable. So level 1, because we're only doing the anterior, usually the upper 10 anterior teeth, you want to have stable occlusion. Level 2 and 3, if they don't have stable occlusion, even if they've got TMD symptoms, that's okay, because what we're going to do is we're going to use the orthotic to stabilize the bite. And then we're going to rebuild their bite to that orthotic bite. In all 3 sessions, we can do soft tissue gingival recontouring. Level 1, as I mentioned, we prefer you do veneers. Level 2 and 3 can be really a combination because when we start doing, 28 teeth, you could have bridges, you could have crowns, you could have veneers. We're really focused on bite management more than veneers. Veneers were level 1. So level 1, as I mentioned, when it comes to crowns and bridges, try to avoid bridges because you'd rather just focus on smile design and veneers. So try to keep even the number of crowns to a minimum. Whereas in level 2 and 3, doing crowns and bridges or even implants, that's okay. Level 1, try to stay focused on veneers. Level 1, again, just to kind of quickly review, we cover photography, smile design, case presentation, lab communication, materials, conservative aesthetic preparation, soft tissue recontouring, multi-unit temporization, and cementation. Level 2, all the above from level 1, but now we really get into occlusion, bite registration, and the use of orthotics. How to do the bite transfer, how to use a bite registration stent, how to prepare the entire upper arch without losing the bite, how to temporize the entire upper arch, and then how to do full arch cementation and deal with an orthotic again. Level 3 is everything that you learned in level 1 and 2, occlusion, but now we're working 2 arches, temporizing 2 arches, and cementing 2 arches. And then we'll go deeper into coronoplasty, which coronoplasty for me is really all about, it's equilibration, but maintaining the anatomy and tooth shape of the restorations. So very excited to get into all of that. All right. So here is some cases, color change cases. So think about, hopefully now you're going, okay, I'm gonna sign up, right? I need to reinvigorate my career. I need to take my career to a different level. This sounds great because these are friendly people. We're gonna have a lot of fun together. And now I understand level 1 is really about aesthetic cases. So now I want you to think about the cases you have in your practice. Do you have somebody who wants color changes, where they've got dark teeth and maybe they have tetracycline stain and they've come to you before and they said, hey, I'm tired of my gray teeth, my brown teeth. Can I have that Hollywood white smile? They would be perfect. Let's say you have a patient that has some black triangles in between their teeth and you've thought about maybe doing closure with composites, but they've got a lot of them and they want to change the shape of their teeth and the color of the teeth. That would be great. Let's say you have somebody who has diastemas and they have done or they don't want to do ortho, or maybe they've done ortho and now they have diastemas. That would be perfect. If you've got a patient that, close this up. If you've got a patient that has rotated teeth and they don't want to do ortho, hey, we can prep those teeth and make them look straight. If they've got a midline discrepancy of no more than 4 millimeters, we may be able to correct that midline discrepancy if it's really bothering them. It's kind of that Tom Cruise type of issue. If they've got peg laterals or they've got some small teeth and just not a very aesthetic smile because of the tooth size discrepancy, that would be a perfect case. As you saw before, if they've got the reverse smile line where their anterior teeth are worn and look short, that would be a good case. If they're class 2 or 3, possible cases, right? So, your instructor or your mentor would be somebody good to say, okay, here's my patient. What do you think? Would this be a good case to do? And if you have patients, sometimes they've got a lot of composites in their anterior teeth. And when they smile, they might even have composite veneers. That would be an okay case. If somebody has a lot of porcelain veneers, those are a little bit harder to take off. So maybe not as ideal. But if they've got like a lot of composite restorations, we could probably deal with that. So any questions on case selection? We're pretty open to things as long as it's, reasonable. The only caveat I would tell you is sometimes I get doctors who they want to bring their worst patient to the course because they figure, well, I'm going to bring the worst case because I've got help to do this case, so I'm going to bring the worst case. Usually doesn't work out too well. Not that we can't get through the case, but it's not easy to do, and we do have time constraints, during these courses. So don't try not to bring your worst case. Bring one that you can manage within the time frame of the course. Anybody have any questions or tips? You're all good? All right. So I just want to explain because I told you how we're all very collegial. The way the leadership part works is we have the doctors and the team taking the course, and then we have the instructors and the mentors, and then we have the course director. And the only reason there's a little bit of a hierarchy of levels there is that if the doctor has a question, the instructor is probably going to be able to answer that question. But if the instructor is stumped, then we go to the course director. So the course director, if we're thinking, we're not quite sure how to handle this case, usually we'll just go to the top and say, okay, you decide what to do. But when it comes to the participation part of the course, like we're actually in the clinic working with you and your patients, we're all on the same level. We're just all colleagues working with each other, and that's what makes this really fun. It's as I mentioned before, we have some young doctors that will come and take these courses, and I don't know, when I think about dental school, it makes my palms sweaty, right? But with these kind of courses, it's not like that at all. We are just working together. All right. So what I want you to understand is now you understand levels 1, 2, and 3. Now you understand what we're looking for each of those different levels and the importance of taking these courses. Now I want to talk a little bit about case presentation because it's really hard to go up to your best friend and say, hey, we've known each other for the last 20 years and, you've got a really ugly smile. And I have this great opportunity. We can bring you to this course and we can actually rejuvenate your smile. Some people will take that offensively. So the way that we do it in our practice is we always have our patient fill out this intake form. And the intake form is like, do you like the appearance of your teeth or your smile? And if they check off no, then all I have to do now is go in and provide a solution. Mrs. Jones, you checked off you don't like the appearance of your smile, that your teeth aren't aligned, that you've got spaces between your teeth, you don't like the color, you don't like the shape, your teeth are chipped, and you have these dark things in the back on the chewing surfaces of your back teeth. Well, I've got a solution for that. We can replace all those and improve your smile with veneers. On the right-hand side, that's our intake form where we vet out their TMD issues. So, Mrs. Jones, I see you've got clicking and popping in your jaw joints, head pain, neck pain. You clench and grind and you don't have a comfortable bite. Guess what? I could take care of that. We were doing this course, and during this course, we can actually take care of the aesthetics of your teeth, give you better function, more comfortable bite, and maybe take care of your headaches. Oh, so now your patient's kind of intrigued by this. And these are the things that we'll go through again during the course just to make it so you're able to do more aesthetic cases. Another thing we'll talk about is the photography. And why the photography? Because sometimes patients, all of us have things about us that if somebody looked at us, our appearance, our hair, our face, or whatever, they could nitpick things, right? Now he's got a blemish here, he's got a blemish there, his teeth aren't straight or whatever. But when we look at ourselves, we don't see those blemishes. So, I say we've become habituated to it. It's like when you go in a smelly room. When you walk in a smelly room, you smell the smell. And then once you sit there for 5 minutes, you don't smell it anymore because your nose becomes habituated to that smile. And a lot of us get to be like that visually. But imagine this patient comes in and she says, my smile's fine. So she fills out the questionnaire, my smile's fine. I like the appearance of my teeth. No, I don't have anything I don't like looking at. And then you take a good photo and you put this photo up on your 55-inch screen in your consultation room or in your operatory. And now the patient looks at that and says, wow, now that I see it as big as it is up on the screen, I can see how my teeth are chipped and worn. And, wow, what's this dark thing in there? And you tell them, well, that's just a filling, but it's just stained over time. And you can see how thin these teeth are here because they're wearing down. Well, you've got some bite issues. Look how you're wearing these teeth. And this patient actually was only in her 30s, yeah, low 30s. And so when you look at all that wear and tear, and then the other thing I point out is, well, here's the middle of your top teeth right here, and the middle of your bottom teeth is like way over here. They're not even one over the other. So then you really start to look into the functional issues because is that a skeletal thing, a joint thing, or a dental thing, right? So we have to figure all that out. But now the patient's more likely to say, so what can I do about that? You're not even selling this to the patient. What you're doing is you're just pointing out what's there, and you point out some of the things, the wear and tear and the discoloration. And now the patient's asking you questions, and all you're going to do is offer them solutions. So, Mrs. Jones, what I can do is I can make all these teeth the same color. And these teeth, where they're worn, I can restore that worn tooth structure to make everything look uniform. Remember that smile that you had probably when you're in high school, but now you've destroyed it, basically? We can restore that for you. So here, you pick out the type of smile that you want. Do you want it where the edges of your new teeth go straight across? Do you want it where the edges of your new teeth are nice and round to create like a soft look? Or do you want something in between? And the patient's like, wow, one, I didn't even realize I had a problem. Two, I now that I see the problem, I'm glad you have the solution. And I'd like door number six, right? So now they're on board. And all you had to do is you had to show them what's going on. You had to offer them the solutions. I say it's forming a gap, right? Because they didn't even know where they were starting, but now you've shown them with that photo where they're starting. Now you're showing them where they could end up, like, just on this one sheet. And now they're starting to put some value on this. They're like, wow, you know, that could change my life if my teeth look like that versus how they looked like in that other photo. So we start to, one of the things we talk about is smile design. We have to get into the patient's mind. What is it that they're seeking? What do they want in the final restorations? And that's part of the system I talked about that you'll learn at the pack. Because when we send our models in for the diagnostic wax up, we're going to guide the lab and tell them how we want the wax ups to be done. When we make the temporaries, our temporaries are going to reflect that wax up. And then we're going to ask the patient, so what do you think? And most of the time the patient's going to say, hey, I love my temporaries. But if you get that one case where the patient says, you know what, I wish the teeth were more straight across, or I wish this tooth was more pointed, just look at the patient and say, hey, no worries, because this is why I got you back, because I want to make sure we give you the smile that you want, not the smile that I think you want. And that goes a long way. So what we do now is we have selected a cooperative patient, and the financial incentive now is that if you were to do the veneers in our practice, those 10 veneers would cost you $17,500. This says, just say you're charging $1,750 per unit, right? So it's $17,500. Throw in a diagnostic wax up. Now we're up to $18,000. I can do that case for you for $10,000. I can give it half off, 50% off. I can do it for $9,000. And why can you do that? Because the cost of taking the course is basically $5,000. And that $5,000 isn't to pay your instructors. It's basically your lab fee. So you're doing 10 units. And so you get 10 aesthetic units, you get the diagnostic wax ups, you get all the lab preparation, lab communication, you get the techs there during your prep session and your cementation session, all for that one low single price. And that fee you then can charge to your patients. And so that fee will be covered by your patients. So you're not going to lose money. And if you want to charge them $20,000, I've done these courses. That's up to the discretion of the doctor. I've done these cases or these courses, cases during the courses where the lab fee is $5,000 and the doctors come in and they charge the patient $25,000. And I go, well, how much is a veneer in your practice? They go, $2,000. I go, okay, so $2,000 times 10 is $20,000, and you're charging the patient $25,000, and the doctor says, yeah. I go, why? And they said, because I told the patient, you're going to have all these eyes while we do this case. You're going to have internationally renowned instructors that are going to help us make sure that we get the smile that you want. And so you're going to pay a premium. And so the doctors will charge the patient more than it would be for them to do the case in their practice. So when I have doctors that are interested in taking these courses and they go, but I can't find a patient that needs aesthetics. When I went to that case selection sheet, we all have patients that have those types of smiles. And then I have doctors that say, well, I can't afford to take the course. And I go, well, you can, because in this case, your patient's paying for the course. So there really aren't any obstacles to taking this course. So we're selling the opportunity. Well, we're not selling the opportunity. We're just selling them the ability to take care of their wants. So they want a nicer smile, and we get there through education. Garrett, I put this slide in for you. This was a couple weekends ago. So here's the course photos. This is just showing how, we're working with the doctors. The doctors are prepping. We're watching over the shoulders to make sure, if there's something that we want to change a line angle on or a margin on, we've got an instructor and myself looking to just double check everything, right? Triple checking. And that's why some doctors say, hey, I'm going to charge you extra because you're going to have extra eyes on this case. And you can see that we're all working together. We're discussing the cases. We're discussing if there's anything that can be improved. The lab technicians come over and they if they see something that they want to have changed, they'll ask you, hey, can we just move this margin over here, or maybe do a slice prep or whatever it may be. So it really is interactive. So you have your patient, you've got your smile design selected. You want the nice, soft incisal edges that are slightly rounded. So we fill out the lab slip. The lab step's going to say, hey, how long do you want 8 and 9 to be? I'm going to let somebody else in here. So how long are the stencils going to be? So you write down tooth number 8 is going to be 11 millimeters long. Tooth number 9 is going to be 11 millimeters long, whatever it is that you deem that you selected. Down here, you tell the lab, what's your smile design? Or maybe you have some photos or magazine pictures. So you send that to lab and tell the lab, please match this shape of these teeth to the diagnostic wax up. Down here, it's a great question on the lab. So goals of the new smile design. Like, are we trying to adjust the midline? Are we trying to widen the buccal corridor to get rid of negative space? Are we trying to lengthen the teeth, change shades, close diastemas? Whatever is appropriate, just check that off. It just gives the lab more insight. What are we trying to achieve with our diagnostic wax up? And then even on the diagnostic wax up, we can ask for different surface textures because that will be reflected in our temporaries because our temporaries are so accurate that if the lab and the diagnostic wax up puts uh, pericarmata in there or whatever surface texture, that will be reflected in our temporaries and it lets the patient get used to it. So if we envision the patient wants a medium amount of surface texture on their teeth, their final veneers, and we make the temporaries that way. And the patient comes back the next week and says, hey, these teeth aren't smooth. You know, I want smooth teeth. And these teeth have all these little, it's like texture in it. You know, we as dentists, we look at that like, yeah, I love that. That texture is what a natural tooth looks like. And your patient comes back and says, no, but I want a chiclet, like something really smooth. So we learn that while the patient's in the temporaries. It's okay if the patient wants smooth chiclet teeth. I mean, it's their teeth, and if that's what they want, that's what you give them. And then down here, so we check off the small design. So this is a checklist. So we check off, we would have selected a small design that we put over here. We take a bite registration, maybe with a stick. So if we have to level out the occlusal plane, we take a stick bite that has a vertical and a horizontal stick on it. So the lab knows where to level out the maxillary-occlusal plane. And then anything else miscellaneous we put over here. So if you say, hey, I want tooth number 7 and 10 not to be symmetrical, or hey, I want, whatever you want, you would just put that over there. So now I just want to show you kind of the application of this. So we've got a case, patient comes in. This patient has spacing between the teeth, and you can see like number 6, kind of a funky shape to it. So we had a diagnostic wax up done. Get the diagnostic wax up done, nicely done by Corr Dental Lab. And then we're going to do a smile preview. What does that mean? Is before we get the patient into that live patient prep session, I call the patient back in the office. And the patient in this case had crowns on 8 and 9. So I told the patient, come on back in and we'll just do an acrylic overlay over your teeth. And, if you look at his teeth aren't that bad. These are crowns 8 and 9. The other teeth, maybe doesn't pop. We talked about whitening. The patient tried whitening, and this is the whitest his natural teeth will get. And he wants a pretty white smile. So I was thinking this is going to be tough because there's not much wrong with that smile. So you start to look at the models. We take our photos so we can communicate to the lab what kind of shade that we want to take. And I will tell you, in this case, what I did is I did my own lab work. And the reason why is because this patient had come in a year previous, and I had sent in to the lab for a diagnostic wax up. It's probably about 2 years before. And the patient never came back. And so I had this diagnostic wax up. It sat there for a year. Patient didn't come back. And I just never thought the patient was going to come back. So I actually threw the diagnostic wax up away. And then another year after that, the patient came back. And I was like, I'm not spending that money again until I'm sure the patient's going to come back. So all this, the lab work that you see that Cord is going to do will look even better than this. But this is just the lab work I did because I wasn't going to send it all back in again. So what I did is I got him back in, and from this temporization stent, I just told him, I said, I'm going to do an acrylic overlay over your teeth. So we did an acrylic overlay over the teeth just to kind of even things out, soften things up a little bit. So just let him take a look at what the smile could look like. I peel those off. I want to see how thick it was that I made that wax. And you can see that I made them fairly thin. So then we do the 50-50 where we take off the acrylic overlay from 8 back. And so from 9 back, you can see the acrylic, the color change, and just a little bit of the shape change. So we do our photography. And when it comes to photography, if you don't have, I use a digital SLR. If you have one of those, great. If you don't have one, you can use your iPhones or Androids, whatever it is that you have. You don't have to buy a special camera just for this course. But the photos that I recommend that you take when you submit your cases to your mentor, instructor, and to laboratory would be at least this set. So this is a full face smile, a close-up smile, close-up right and left side patient smiling, a close-up of the anterior teeth, a close-up of the patient's right from a lateral view, the left from a lateral view, and then the occlusal views. So those 9 photos I'd recommend that you take. They don't have to be beautiful or anything like that. What I saw during the courses that we've done is the first time, our first course where the doctors sent their photos in, I was looking at them on my phone and I was joking because I was like turning my phone all different ways, trying to figure out where the teeth were. And I was trying to figure out if my eyesight had gotten that bad. Nothing was in focus and nothing was framed very well. But we were able to at least see the teeth, so we were cool with it. It's just part of the learning of what you're supposed to do. So then we come up with a plan. And so at this point, you come up with a diagnosis. Am I going to do 10 veneers? Am I going to do slice preps? What are we going to do? So once you have your treatment plan and your records, so you got your models, you got your photos, now we go to the course director or to the mentor and we have the case approved. Now it goes to the lab. So the lab, we've got all these different materials we can use depending on the strength, the aesthetics. What I do is I rely on our technician's advice. So I would go to Ryan or Gary and say, hey, I've got this tetracycline case, but I want to do really minimal preps. What type of material would I use to accomplish that? And so, they would be mixing opacity with translucency and trying to figure out, okay, how do we get the nicest aesthetics with what we have to work with? We have to figure out, do we want to take more tooth away, do deeper preps, or do we not want to do that? So this is what I recommend you send to lab. You send either analog or digital impressions, a bite registration. So one of the bite registrations we use is the Cois Dentofacial Analyzer. So with this one, you have the vertical stick and you have a horizontal stick. If you have one of these, that would be ideal to send to lab with your case. Photographs, the treatment plan, as I mentioned, the smile design selection, and any other instructions that you have. So that's how we set it up. Again, very easy, and it's a system. So when we get into the clinic, we've got everything. We've got our models, we've got our wax up, we've got our temporization stents, we have our prep guides, we have our bite registration stents, and everything's measured and accurate, and we are ready to go. So when we get all this done from our lab, it's going to make the case rather easy. Although when I say, we're going to do 14 or 28 units, it sounds kind of scary. So with the proper planning, it's going to lower the stress for you. It's going to help you achieve what your patient wants. It's going to help the whole procedure, the process to go much more efficiently. And that's why to do 10 units, we can get it done in usually way under 3 hours. It's going to be a team thing. It's going to be you, an instructor, and a lab technician working to be sure that we get everything the way we need it to be. Because if we plan everything properly, we're going to have great success. We're not going to have that poor performance that we're trying to avoid. When you come and take the course, I outline everything. I have the time all figured out, what you should be able to do within that hour and a half here, within the next 15 minutes here. So it kind of is, I give you a list to kind of pace yourself. I don't want you to get way behind, and sometimes you'll get way ahead, which is preferable. In this case, what I want you to start to do, we talked about this during our other sessions, is really think about the whole arch, not just one tooth. Meaning when you put your recontouring, if you're going to do some arch recontouring, you're going to put your big fat diamond on, real coarse diamond, and we're going to go across all 10 teeth. And if we've got a lot of tooth rotations, we're going to cut those parts of the tooth that are sticking too far out. We're going to just cut all that back. We're going to go across all 10 teeth. Then we're going to take our depth cutting burr. We're going to put that in our handpiece, and we're going to go across all 10 teeth. Unlike how a lot of us do our traditional dentistry, where we might prep out one tooth, and then let's say we have a tooth on the other side of the arch, then we prep out that tooth. Well, in this case, we've got 10 teeth and we're going to prep them out like they're just one big tooth. And so that's a little bit of a technique change for some of you. But I just want to show you that we have everything mapped out when it comes to the prep session and to the cementation session. So what you'll do is you'll get kind of these pacing lists. And what I'll ask you to do is just stay really close to that on time. And don't worry, like if you're starting to get way behind, let's say we've got 3 hours and you start to look at this checklist and you're like a half hour behind, and then you just call the instructor over and say, hey, can you show me how to do this? And what your instructor will do is your instructor will get you back on the timeline. So again, no need to stress. So when we get the preps done, you know, you have your reduction guides, you'll be able to get your impressions, your bite registrations, and then we'll take our temporization stent, we'll make our temporaries across all the teeth. When it comes to cementation, we'll take the temporaries off and then we'll do the multi-unit cementation. We'll go through how to do this so that you're not going to be struggling with the cleanup, that you get everything seated the way it needs to be. We'll give you a little tips like the tacking tip, just to tack it into place so it doesn't move. And then you can floss in between all the other teeth before you do your final cure. Sometimes we do get cement that sets up in the contact area. So then we take the little separating discs and get in there. So we talk about all that. So this patient, he got the smile that he wanted. He's super happy every time I see him. It would be hugs and kisses, but I try not to get the kisses from him. But he loves his smile and he's chomping at the bit. He wants to do his lowers. And so we're just trying to figure out when we're going to do his lowers. So again, here's the case selection choices, just as a reminder. Want you to think, how many patients do you have that fall into one of these categories? You know you have patients that fit into here. And then just kind of a quick review of how the sequence works. It's just laid out. It's really efficient. It looks like a lot, but then what we do is we just chunk it down. And because we chunk it down, you'll get through it and it won't seem like a lot of work at all. It's really fun. And so now I hope you see that from taking these courses, you get the systems. And when you get the systems, you just take that back to your office. You know, what materials we use, what burrs we use, everything is laid out for you. Just go back to your office and tell your assistant here, just order this stuff. And we're just going to start doing aesthetic cases. We give you the vision. You have guys like Dr. Griffin, who he's retired twice. You know, he's made it big twice. And you have a chance to sit shoulder to shoulder with him and say, okay, now how do I do what you just did or what you've done twice? And then we're all going to encourage you. You know, we've been doing this for decades. We want to make sure that you take the information from these courses. And again, it may be an investment of $5,000. And I hope you make money doing the course because you charge your patients more than the $5,000. But it's one of those things, there's no better investment. And we talked about this during a recording that we did recently. Is a lot of us, when you get to our age, you look back and you go, man, I should have invested in Amazon, or I should invest in Google, or I should invest in Apple. You know, if I had invested in Apple back in the day, I'd be a trillionaire by now. One of the things that you don't want to look back on at the end of your career is where you say, wow, I should have invested in myself, in my career. Because if you invest $5,000 in a course like this, you're going to make during the course of your career $5 million back. It's way more than a 10-to-1 return because aesthetics will affect everything that you do. And when patients see that you understand aesthetics and you understand function, they will seek you out. And that's one of the crazy things that in our office, we have patients that come in every day because they have functional issues. I'm treating my youngest patient I'm treating right now, he's 14. He's got TMD. And the oldest patient I have right now, I saw today, she's 91. So these patients will seek you out because you just provide a totally different level of service than anybody else in your community. And that's the way you want it to be. I was talking to my daughter today and I said, you know, you don't want to compete, so to speak, against everybody else that's doing crowns and fillings. You want to find your niche, something you enjoy doing. And for me, you know, it's implants, it's aesthetics, it's occlusion. My daughter, I'm going to let her do airway. And so, you know, I just like to do certain things, aesthetics, implants, and TMD is kind of where I focus a lot of my attention to now. But those of you that, because I didn't do any kind of introduction, you know, I teach endo courses, I teach laser courses, I teach aesthetic courses and restorative courses and so much more. So I just like all parts of dentistry. So I just wanted to go through that part, and I know I covered a lot. I was trying to cover it fairly fast because it is a weeknight. I don't want to keep all of you up too late. I know if you're watching from Chicago, it's getting late. But I'm going to open up to questions now. What questions do you all have?
We have some questions in the chat, Doctor.
Okay, let me open it up. I know, when you do these things, there's just so much to keep track of. I was trying to let everybody in. And does Corr Lab do orthotic? Ryan and Gary, are you guys doing orthotics now?
It's not our forte, but we know how to do them.
Okay. So
we can also do Coisty programmers if that's
Right.
something that
Yeah.
open the bite.
Yeah.
So, yep.
I don't use Coisty programmers, but if some of you do, then yeah, you could send it to Corr. And it's one of those things where it's kind of a tricky question because it depends on what kind of orthotic you want. If you want a fixed orthotic, then Corr can make that for you, right? Because it's just made off your diagnostic wax up. If you want a myoliner orthotic, something that's more anatomic, we have to send that to myoliner. And then if you want a removable orthotic, that's kind of what we're talking about. If you want a removable orthotic, you can use a lot of different labs. All right. Another question, what tools, materials, or equipment do we need to have? That's a good question. So what we have is we have the impression materials, we have the temporization temper materials. We have like hemostatic agents, curing lights, and all that. What we do ask the doctors to do is bring your favorite uniform, bring your loops, bring your favorite instrument. So I bring like at least a basic instrument tray, just so you have all the instruments that you need to have. Typically, we have the hand pieces, we have the burrs. So as the course gets closer, Lisa will reach out to you and let you know what you need to bring and what we'll be able to provide. But typically, it's just the basic instruments because we provide the soft tissue lasers, we provide the hand pieces and burrs and the restorative materials and the impression materials. So there's not much that you need to bring. And then I know some of you have your favorite like pillows and blankets. So if you have a favorite pillow blanket, either for yourself or your patient, bring it. Other good question. How many cases will be done in one day and where will they be done? So I will defer the second part of that question. Where will they be done? It depends on which group you're signed up for, Sacramento, Bay Area, Chicago. So again, Lisa will send that information out to you to give you the right address. I don't want to send you to the wrong place. How many cases will be done depends on the number of doctors that are enrolled in the course. So in the Sacramento and Bay Area courses, we max out at 10 docs. And so what we do is we will have 5 doctors working and 5 doctors assisting. That way you get to see 2 cases, your case and another doctor's case. And then usually you have a chance to walk around and see the other cases. So you have a chance to kind of observe 10 cases being done. But it's 10 cases during each session. And usually it's 5 doctors working at a time. Let's see. I have a patient for full mouth reconstruction who most likely would want to start. Do I have to start with veneers and can I bring her in? Yeah, it depends. So on that, Dr. Parsa, I think what we would do is, because I know you know how to do this stuff and I know you've been doing this. So on that one, I think we would do it on a case-by-case basis where we would talk with you, look at the case and figure out how much time we need to have you do that case. So I don't want to say no to it. I just would say we are open to seeing what the case looks like, and then we could make a decision together. So that's a great question. Another great question is I don't have a patient. Can I still be part of the course? That depends because we're kind of limited by space. So we've done courses where we had some doctors that didn't have patients and they were able to observe, but that's because we didn't have as many bodies. What we're afraid of with these courses is that we're going to have full courses. And so if you don't have a patient and you're not doing the course, it's going to be hard to have more bodies in the area. So I hope that makes sense. It's just we're limited by the number of bodies we can have in whatever clinic that we're working in. So it's not that we don't want to have you there. It's just we're limited. We can't have 40 bodies in somebody's office that, let's say you have a 5-op office that we're using to do the course. Well, you all can imagine what it'd be like to have 40 bodies in that space. So that's the limiting factor. What I would just say is just find a patient, right? We all have patients that look like one of those cases that I showed you. They got dark teeth, worn teeth, whatever. And so that's the hard part is we need to just have you sit down with the patient. And I get it. It's hard to do. But that's one of the things that we're trying to teach you during this course. We're trying to teach you how to identify cases and how to present the case to get the patient to say yes. And in this case, we're taking out all the financial obstacles, well, potentially, right? So tell the patient those 10 veneers in my practice would be $20,000, but I'm going to do it for you for half of that, for 10,000. That way you get the course paid for and you make money and you don't have to pay for office overhead because you're not doing the case, in your office. Yeah, the other question was the Bay Area course will be held somewhere in San Jose. And as Jimmy was saying, and the dates, we have the dates, and we can have Lisa send the dates out to everybody once again. So we do have the dates. We do have the dates for Chicago. We do have the dates for thanks, Jimmy. Yeah, the 22nd, 23rd. We do have the dates, and we do have for all the different areas. Let's see, do we need to bring assistants since the doctors will assist each other? That's a great question. So what we recommend that you do bring your assistant. Why? Because then your assistant is trained to help you. When you go back on Monday, if you have a veneer case in your office, your assistant will be able to pick it up. So what happens to the doctor that I said was assisting? That doctor is helping the assistant assist, basically. So typically what will happen is we have 2 doctors per operatory. One doctor will work in that operatory in the morning. The other doctor will work in that operatory in the afternoon. If the doctor that's working has her assistant, I'd recommend that assistant assist the doctor.
Okay.
And then what we'll do is the doctor that could have been the assistant can just look over the shoulder. So it's easier for that doctor, but I'll tell you, it's like all hands on deck, because the assistant may be looking for cotton rolls, and so the extra doc runs around to find the cotton rolls, that type of thing. So it's really fun. We're all kind of helping each other out.
Doctor, I just want to confirm it's August 23rd and 24th, Saturday and Sunday, correct?
Saturday and Sunday, yeah. Is that
So that
22nd,
that's
23rd?
that has to be on the 23rd and the 24th of
Okay.
August.
Okay. So it'd be 23rd, 24th.
Sorry, it is 23, 24.
Yeah. Okay.
Mike, can I make one more comment?
Yes.
Along the lines of bringing your assistants there, you'd be amazed at how empowering this becomes for them. They get excited because they learn the same information you learn on Friday, and then they see the cases delivered and they realize, now I know my doc can deliver these kinds of cases. So it's pretty exciting.
Yeah, correct. As I was going through with my career, I got into level 3 types of cases. And when I would leave my office on a Friday to go lecture somewhere, I would come back and I would look at my schedule, and my schedule would be full mouth consultation. I'm like, where did this patient come from? My assistant would say, oh, so and so came in during a hygiene visit, had warranty, so we told them that they need a full mouth rehab, and so he's coming in to talk to you about that. And I'm like, wow. So my team had taken the courses with me. They had sat through the lectures. They had assisted me when I was doing my level 3 cases. And so as Gary's saying, they're trained. They know what to look for. When an assistant walks in and says, hey, you need a full mouth rehab, the patients are less apt to not believe them. They're like, really? Do you think I need that? And your assistant says, oh yeah, Dr. Mike, he does these cases all the time. What we need to do is do this, this, and this, and we need to get you set up for that. And the patient's like, oh, okay, let's go ahead and do it. Whereas, sometimes when the doctor comes in, the patients are like, do I really need to do this? Or is this just something you want to do to me? That type of thing. So it's kind of not, it's nice when your team is on board.
Hey, Mike,
Yeah.
can I jump in just to qualify and clarify the course fee?
Yeah.
The course fee is being sponsored with a scholarship through the Pacific Aesthetic Continuum. There is no course fee. The clinical fees and the fee for the program have been waived. The only expenses for the program are the cost for the case, which is a flat rate of $5,000, which includes the preliminary wax-up and all of the stints, et cetera, et cetera. So for those of the doctors that are wondering what the cost for the program is, the hard cost is only the laboratory work, and that's a flat rate. The rest of this is limited. The rest of this is limited to the scholarship expense, which is being provided to you by the PAC.
Yeah. No, great way to explain it. And so, Garrett, one of the questions was the course fee for, level 1, 2, and 3. So the course fee for level 1 is 5,000. And for level, like when we get to level 3, that would probably be twice that, right? Because we're doing
Correct.
upper and lower.
That's correct.
Yeah.
That's correct.
Another question is good. Will patients be coming both days? No, they only have to come the second day of the prep session, which is a live patient treatment session, and the second day of the cementation session, because that's the live patient. The first day of each of the prep session and the cementation session, or those weekends, those are just lecture for the doctors and the team. So the patient does not need to come. So the patient's only there for one of the 4, or one of each 2-day session. So 2 out of the 4 days. We'll
Doctor,
see. Oh, go ahead.
just in case if they have more than 10 teeth, do we have to pay the extra fees for lab for that? Just in case, like just say, pretend that they have a bridge and it's go all the way to the, the molar, for example.
Like number 2, huh? Yeah.
Or even like first molar.
Yeah.
Something like that.
Yeah. First of all, yeah, you're right. Garrett, you want to ask that one?
Yeah, the answer is yes. And we will typically see, rarely, but that can happen. Or you might choose to do an onlay in the back of the mouth, and we leave that up to the discretion of the doctor. But the answer is yes. The laboratory fee is based on doing 10 units.
Gotcha.
We generally will never do less than 8 ever, and normally we'll do 10 to 12. So figure that in your discussion with your patient.
And that's great. That's a great question, though.
And
then
how much more do you charge per unit? Since it's a 5,000 for
Yeah.
a whole entire 10, so then that we know, let's just say, for example, I only charged 5,000, so I can get all the patients to do the course. And so,
Yeah.
for example, if they have extra unit that they wanted to add on there, or we need to add it on there,
It would,
how much
great
more?
question. Yeah, it would be, depending on the unit, it would just be the posted lab fee for that extra work for the lab.
So Garrett, what is that about? That
350.
350. Okay, like
Yeah.
350 extra.
Okay,
Yeah.
$350.
Yeah, because part of the reason why doing the 10 units is a little bit more than their usual, because that includes like the diagnostic wax up and everything like that. And if you were doing more units, yeah, it wouldn't add a lot. It wouldn't add $500 for each tooth into that fee.
Correct.
Yeah. I don't know, Lisa, you're on here, right? I don't have one of the questions is CE units, and CE units are given, but Lisa, do you know the number CE, or Garrett, do you know the
Sure.
number?
I can answer that, or you can answer it, Lisa. It's 32 CE credits
32.
for the program.
Okay.
And it's AGD, California CE. And there's CE for each of the areas that we're working.
Okay. Cool.
Okay, it's up to 32, just in case if we only do a morning session, that could be a little less, but it is up to 32, most times 32.
Okay. Thank you. So August 23rd is the lecture, and August 24th is the patient treatment day. So yeah, the patient's only there on the 24th. That's correct. And when will the second session be? Lisa, what's the second session? I don't have my
It's
calendar.
Saturday, the September 20th, and Sunday, the 21st for San Jose.
San Jose. All right. Well, Garrett, I know I missed something, and thanks for filling in on how the fees work and how the tuition works and the sponsorship. Do you have anything else you want to add in?
No, I think you did really well there. The only thing I would say is that the patient is the real winner here. Normally these courses can be anywhere from 5,000 to 9,000 for the doctor, plus the lab work, plus travel, which is pretty typical to see $20,000 to $23,000 spent traveling to a program 2 times, covering the patient's expenses for hotels and flights, blah, blah, blah. So I think what's really unique about this, it's so unique. We are limiting it to 10 per area. And I know that we had about 18 interested for San Jose. Chicago is a closed program. And I think we have 3 spots available for Chicago for outside doctors yet to be determined. as well as Sacramento. So I would just really encourage you to try to register early because we are going to take the first 10. And understand if you do register for the program and the scholarship is awarded, that place is locked in for you. And you would be responsible for that $5,000 lab fee because we can't fill that spot with only a few weeks left in the course or a month left in the course. So what we're trying to do tonight is to really encourage, for example, in San Jose, the 18 that said that we're interested, we are only going to issue 10 for the summer program. And then for the spring program, we'll open up another 10 as well as level 2.
Yeah. No, thanks.
Hey, Garrett, I was just thinking out loud in my mind. If we have open space in Sacramento, out of those 18 doctors that, if we book San Jose, if they're willing to come up to Sacramento, would that be okay?
Absolutely. If somebody wants to come up from San Jose, they're more than welcome. If we have space. Good point.
I'm just looking at
The only other thing, Mike, I wanted to mention is the armamentarium.
yeah.
Lisa will, it was a great question. What do we have to bring? I think you said, we have to look back at the recording. I think you said we provide handpieces, but we do not provide handpieces.
Oh, we don't?
No.
Okay.
The full armamentarium will be provided to you by Lisa. And we will always bring backup whenever we can. For Chicago, Tio and Robin are making sure that everything that needs to be there will be there. For San Jose, Lisa will provide a detailed armamentarium, and the expectation is that all of those supplies are brought by the clinician. In the case where we have an issue where something's missing or we need something extra, we'll bring generally 1 or 2 setups, but there are some specific things that the doctors will be required to bring. For example, there'll be hand pieces in the clinic, but we encourage the doctors to bring their favorite handpiece, high speed, low speed, contra angle, etc. Things like burrs and burr kits, those will be provided to the doctor in the armamentarium, but we will also bring some of those things. So if there are things that are out of reach or there are things that you have difficulty finding, or for example, your clinic doesn't have a laser, then of course, Lisa will make sure that that's there on site.
Okay. Sounds good.
But you're encouraged to bring anything that is your favorite. I mean, if you come up and go, I need this, I don't carry, extra little favorite things. If you have something that you've been using for years, bring it because you won't find it in my supplies. So think about that. Just little things that you want all the time, please do bring.
And Lisa, when do you send out the armamentarium once we have the registration fulfilled?
Pardon me?
When do you send out the armamentarium? Once we have the registration fulfilled?
That's correct, yes.
Okay. So we'll be taking registrations for the next week. We'll be awarding those scholarships, and then Lisa the course will be handed off to Lisa and to Dr. Miyasaki and to Gary and Ryan from that point on. And you'll have a lot of communication with them.
Sounds good.
Yeah.
Who do we submit the cases to Lisa or to you, doctor?
The cases, yeah, you can send, if you've got one already, you can send it to me.
Okay. You want the cast to be sent it to the lab and the pictures to be sent it to you, or how do you want it?
Yeah, what we could do is if you guys are all starting to get cases right now and you want to get everything planned, because that's why we're doing this so quickly. What we should do is probably take your photos. You can send the cast to the lab just so they can start working on it, and then I can do a call with the doctors and we can go over the photos in the case.
Okay. Can you, how do we get the lab paperwork to send it to the lab or the boxes to send it to the lab?
Yeah. So after tonight, we'll be working on registration for the next week. Those of you in San Jose will be working directly with Jimmy. And once those registrations were fulfilled, Lisa will be getting a hold of you. She's our clinic director, and she'll coordinate all of that with you personally. Make sure that you have boxes, make sure you have everything you need, answer any questions.
Do you provide consent forms and release of liability since patient's going to be out of our practices? Do you have any forms specific to that, or we need to come up with one?
I do have a form that is just for our laboratory. It's not for the doctor. It's our consent to be able to do the work with you and the patient. But if if you're going to need one for your own personal, then that would be something that you're going to take care of. But we're covering the laboratory.
So if, for example, which they're going to be in a doctor's practice here in San Jose, right?
Yes.
So do we need to contact, for example, TDIC to get something so that doctor is covered in case patient falls or something happens in that practice?
I don't know, Mike, help me out here because I'm only thinking about the laboratory as far as is doing the work with us.
Yeah, you know, I don't know. It's I mean, it's a good question. I don't know.
Mike, I can jump in. We spent a lot of time on this and on the regulatory part. We really focus on making sure that the licensed doctor working on the patient is in a licensed clinic, and the license for the doctor that's worked, the patient of record for that doctor is being covered by their own malpractice insurance, obviously. And which is why we try to keep the programs, California doctors in California, Illinois doctors in Illinois. We try not to transition those licensures. We've been doing this for a lot of years. We fortunately have not run into that problem ever in the past, primarily because of the quality of the patient care delivered. What Lisa will do is provide a patient release form, which will help you and obviously cover all the liability for putting the program on, and a release form for photography because it's going to be shared publicly.
Thank you.
So as a licensed doctor in California working in an approved clinic, there shouldn't be an issue.
So the clinic that you guys will be working on, it's under a malpractice under medical protective. And I have the entity protective for that as well for all the associates under the umbrella for that. If anyone is afraid of anything, it is fully protected as I have my own, and then I have the entity for the practice as well. To malpractice.
For answering that.
Great.
Okay.
Yeah, no, thank you.
Dr. Miyasaki,
Yes.
some of the doctors were asking if they can get your new patient form and also the Smile catalog to help them present to their patients.
Yeah, the aesthetic questionnaire form.
Yeah, and the Smile, the catalog, and which Smile they can choose.
Okay. Yeah, I could send that to I'll send that to you, and then you can give it to whatever doctors want
Okay.
to use that. Okay.
And then for San Jose right now, we only actually have 6 spots left. Doctors are already confirming with patients right now.
Okay. Cool. All right. No, that's good because I know we just were talking about it 2 weeks ago, so it's good. All right, everybody get on board. We'll have fun. Looking forward to it. So now I just want to say thank you everybody for your time. And if you have more questions, that last slide had my email address on it. Please feel free to I'm just looking at, yeah, thanks, Angelo. The one last question that just came through the chat is, if a patient asks how long does a veneer last, what is your answer? Who knows? It's one of those things where if a patient asks you how long does a crown last, I tell them it should go at least 5 years, 10 years. I have patients that have had the same veneers for over 30 years. So, when somebody asks, well, how long should it last? I tell them it can last for a long time. It really depends on how well they take care of them. If you look at their natural dentition, natural teeth, and they're just worn flat, and you don't take care of the occlusal issues, or maybe they're a Bruxer grinder and you don't give them a night guard, they're probably going to do the same thing. And I just let them know that, look at your natural dentition, your natural teeth, you've worn them, you chipped them, you've broken them. A veneers has like the same strength as their natural tooth does. So if you destroy your natural teeth, you can destroy the veneers. So we have to protect them. So that question is, I think a lot of doctors are really anxious about how long veneers last. And so that's why that question scares them. But a veneers should last as long as your crowns. And so how you answer that when a patient says, how long is this crown going to last? They can last a long time. So every case is different. And one question is, do you give the patients a night guard after treatment? Only if they need it. I personally don't give every aesthetic case a night guard. I know some doctors that do that. And why do they do that? Because it just kind of protects your rear end. If you, a patient, you give a patient a night guard and they come in and they've chipped their veneer or they have a crack in a veneer or they pop it off. You just ask them, were you wearing your night guard? And most of the time they'll say no, and you go, see, it's your fault. So, it's kind of a way for the dentist to deflect that. But when I look at it, I go, well, it's kind of my responsibility to make sure we minimize the chances that they damage their veneers. So I'm going to take a look at that. And saying that, I do have patients that do have night guards. There are patients that come in and we're not going to do a full mouth rehab. They're just going to have veneers for the aesthetics. They don't have a very stable bite, but they clinch and grind. So I'm going to say, here, you've got to wear them. And that's one of the things we talk about. When you do your comprehensive exam, if you see signs of wear and tear, you tell the patient, ideally, we put you in orthotics, stabilize your bite, then restore you. Patients sometimes can't afford it or they're not interested in doing that much work. And so you just let them know, I can do your veneers, but it's kind of a compromised outcome because we didn't really take care of all the functional issues that are going on. Like, let's say they have a deep overbite and now you do veneers and you made the teeth longer. Well, now they have a more extreme overbite, which means there could be more interferences. But now they have the correct width to length ratio of their front teeth. So where's that compromise? Where is that going to take them? That'd be a case that I'd make a night guard for them. So those are all things that we would talk about during the level 1 course. I know there's a lot to share.
Doctor, the second session start at what time?
The second session,
Mm-hmm.
The second clinic session.
Yeah, like how you have the morning for 5
Yeah.
and the afternoon for 5. So then, because my patient is from Vallejo, so I need to
Yeah.
tell her what time.
Again, it would depend on what level we're going to do that.
Level 1.
Level 1, usually they start at 12:30. So we
Okay.
we have
12.
the patient come in at 12:30, then we start the case at 1 and we get done by 4.
Gotcha.
Yeah.
Thank you.
All right. Well, thanks everyone again for your time. I know I'll
Thanks,
sign off
Mike.
before
Great
more
job.
questions come through. All right. Thanks, Gary. Thanks, Ryan. Thanks, Lisa. Thanks,
Mike.
team, for being here. And thank you, everybody, for being on. I hope you all sign up. We fill the course and we just have a lot of fun together.
Thank
Yes,
you, Mike.
if anybody has any questions, please just contact Lisa. She's our program and clinical director, and she'll answer all the questions. And if she can't, she'll get those questions over to Mike and myself.
Yeah.
I'll be happy to answer those for you.
All right.
Okay.
Good night, everyone.
Good night, everybody.
Night.
Thank
Good
you.
night.
Thank you.